With Devin Vassell out for surgery, it's time to bring in the doctor.
You are Locked On Spurs, your daily San Antonio Spurs podcast. Part of the Locked On Podcast Network, your team every day.
Hey guys, this is Jason David Frank, the Green Ranger, and you are listening to Locked On Spurs with Jeff Garcia. It's morphin' time.
Welcome back to Locked On Spurs. We're here on the Locked On NBA Network. I'm your host, Jeff Garcia, Spurs writer for Ken's 5 San Antonio. Glad to have you back. Happy Monday, everybody. We get you started here work week right here on Locked On Spurs. And what are we talking about today? Devin Vassell's injury/surgery. In case you did not know, the Spurs have announced that Vassell will be out indefinitely as they're going to take care of that troubling left knee. Dr. Ryan McCorkle, frequent guest here, weekly guest here, will be diving into that topic. Then give us his overall thoughts, and then get into the nitty-gritty. What exactly is the procedure that Vassell, by this time, I believe, is ahead. Yeah, he still has the days ahead. So what is going to take? And then get into some NFL injury news that's been across the sports world. Let's go and bring him on. He is Dr. Ryan McCorkle making his weekly visit here, and this is a doozy one.
Yeah, I'm excited to be on with you. We got a lot to talk about this week. Thanks for having me again, Jeff.
Not a problem. You are so in demand lately, from the NFL side to the NBA side. So kudos, Dr. Ryan.
Oh man, it's nice to be appreciated, and it's good to have the opportunity to go and talk about these things. It's a lot of fun.
Absolutely. And follow him on Twitter at Austin ER Doc. And by the way, he is an ER doc at the St. David's Medical Center and Austin Emergency Center. He's also with the Backstage Medical and Concierge Medicine Practice. He's also on Instagram at Austin EM Doc. You want to go there if you want some sweet photos of some sneakers and jersey collection. Dr. Ryan's not playing when it comes to that at all. Thank you, everybody, for making Locked On Spurs your first listen each and every day, free and available wherever we get podcasts. Let's go and dive into it now, Dr. Ryan. Overall thoughts, Vassell had been in and out of games. He played only one of the last 4 games before the Spurs made the announcement. He played in about 20-ish minutes versus Brooklyn, scored 14 points. But, he was just 3 games out, 1 game in. We thought that it was just that ricin treatment, the rest ice compression thing. But yeah, the Spurs opted and Vassell opted to get surgery. Your overall thoughts before we get into the nitty gritty?
Well, I think that he's been kind of playing several games, and then I think it's flaring up on him, maybe even swelling a little bit. And so then he has to sit for several games, and then he gets better and he comes back. We did the ricin treatment that we talked about, and they've been trying that now over the course of a couple of months since the season started. And it's just kind of, a yo-yo effect. So I think given the trajectory of the season, the way things are going, for how it's going to end up, that it just becomes a smarter course of action to go ahead and do the arthroscopic surgery, look and see what's going on internally in the knee, and just shut him down for a little bit, because there's really no downside for the Spurs to shutting him down for a while.
Do you think it was wise for the Spurs and Vassell to play in that Brooklyn game, knowing that knee was bothering him?
Yeah, I mean, I feel like like we've talked about the way it's been, where just kind of soreness, a little bit of swelling, and it's coming and going. And he's of course had imaging by this point, an MRI, looking for any kind of major structural damage to the ACL, the PCL, the menisci, that kind of thing. And given that they don't see that, then it was just kind of ricin and managing, and you're going to have flares. And so it was a reasonable thing to do, to just see how the season goes, because he knew at any point you can shut it down and go have the surgery, and then it is what it is. But there's no reason not to at least give it a shot, because there wasn't anything structural that he was going to make worse by playing.
Right. And for those of you who do not know what ricin is, I'm going to try it out again, doctor. It's
all right.
It's rest, ice, compression, elevation, and non-steroidal drugs. Did I get that right?
Hot dog, Jeff. I am pumped. That was excellent. I believed in you, and you delivered on that one. That was perfect.
Thank you so much. Thank you. And by the way, those non-steroidal drugs, like your Tylenols, your Advils. So yeah, I got the bonus question right. So
that's impressive. Well done.
But no, you look at Vassell, he gave it a go. Keldon Johnson spoke about that, and he told us during their East Coast swing, Brooklyn, New York, that the team doctors of Vassell would not have given him the thumbs up to play against that Brooklyn unless he felt confident enough. And he did okay in that game. As mentioned, 14 points in about 20 minutes, but it looks like it probably flared up again. In your experience, what have people or athletes have told you about that type of injury that Vassell has? What does it feel like? What do they describe?
Well, I mean, we haven't really gotten a real diagnosis yet. It's just It's been left knee soreness. Once he has the arthroscopy, they will be able to actually have a diagnosis. Is there a small tear in one of the menisci? Is there just debris that needed to go in and clean up? Was it just tendonitis? That kind of thing. They've been managing it like it is a tendonitis, with just some intermittent swelling. So we won't know really until we have that definitive diagnosis from the arthroscopic surgery. Because people who have ACL, PCL injuries, they describe an instability. It's not even pain. It just feels, they always say it feels like my knee is going to give out because you don't have the ACL and PCL there preventing the large bone of the thigh, the femur, from sliding around on top of the large bone of the lower leg, the tibia. So it feels to them like it's just about to just dislocate. Meniscal tears, on the other hand, are, especially when the meniscus will kind of fold on itself, people describe that as a locking and an intense, sharp stabbing pain, usually on the inside or the outside of the knee, depending on which meniscus is affected.
Right. Yeah. And you look at Vassell and what they opted to go with. Was this kind of the worst case scenario for him in this situation?
Oh, not. I mean, this isn't worst case at all, because even Popovich talking about him coming back by the All-Star break, that's only about 5 weeks away. A lot of times, if it's pretty serious, you're talking 4 to 5 months. The worst case scenario would be an ACL tear, where you're talking about a year, 9 months of being out completely. That would have been worst case scenario. An ACL, a PCL, or even a torn meniscus would have been extended time out. So I'm thinking this is just going to be what they call a cleanup, where they go in and kind of smooth the edges and clean up debris in the knee that just comes from overuse if he's going to be back within 4 or 5 weeks.
Now, when you say debris, what does that mean? What does it mean by having debris in the knee?
Pieces of the cartilage, maybe even pieces of the bursa sac, just little pieces of the tissues that make up the knee joint, that being cartilage, bone, ligament, tendon, that can just be in there and causing inflammation every few games that he plays. So they go in there and just do some suction and smooth the edges of everything, make sure there's no tears in the meniscus or the ACL, PCL, and that everything looks good structurally.
All right, that's some good information there, but we're not done talking with Dr. Ryan McCorkle right here on Locked On Spurs. When we get back, just a few more overall thoughts, and then we're going into the nitty gritty. What can Devin Vassell, the doctors, what does Dr. Ryan expect to have during that procedure? What is that procedure specifically? Right here with Dr. Ryan McCorkle. Follow him on Twitter at AustinER.Doc. But before we continue, I want to talk to you about, well, it's tax time. Yes, the dreaded time of the year, but don't worry. That's where TurboTax comes in. Go to TurboTax. Don't do your taxes. Meet with an expert who will do them for you. TurboTax experts can relieve you from the stress and taxes and filing. So you know what? They can do it. You don't. Yeah, exactly. Show your eye things that are not taxes. Exactly. Unpack a moving box of not taxes. Taste not taxes. Sing not taxes, a lullaby. Exactly. Hope that not taxes sleeps through the night. Grab a saddle and ride not taxes into the sunset. With the TurboTax 100% guarantee, expert guarantee, that is, an expert will do your taxes from start to finish so you can relax. Feels good to be done with your taxes, doesn't it? Go to TurboTax. Don't do your taxes. Visit TurboTax.com to learn more. Intuit TurboTax. Full service products only. Video meeting while expert does your taxes is required. See guarantee details at TurboTax.com/guarantees. We're back right here on Locked On Spurs with Dr. Ryan McCorkle. Follow him on Twitter at Austin ER Doc, and he's here to talk about the Devin Vassell injury/surgery that a lot of Spurs fans are talking about right now. As a matter of fact, the moment the news came out, everybody, fans were already asking me, when is Dr. Ryan coming back on? Just like that, Doctor. How about that?
Oh, man, that feels nice. I really appreciate the listeners. And they've been interacting a lot on Twitter and Instagram, and it's always fun to talk with them. And it's nice to be appreciated.
Exactly. Well, let's continue talking about the Devin Vassell injury surgery here. Just a few more overall thoughts before we get into what exactly can Vassell and the doctors expect to do this week. You mentioned the cleanup of the debris. You described what that is. I'm just curious, is that something where Vassell will be awake for? How invasive is it?
Oh, no, he'll definitely be sedated.
Okay.
Usually for just an arthroscopy, it'll just be sedation. So it doesn't require you to be put on a ventilator, or to put down to breathe for you. That's called general anesthesia. This would just be what they call twilight anesthesia, where they give you a little bit of propofol or a little bit of Versed fentanyl that give you amnesia, kind of like they do for a colonoscopy. A lot of our listeners are over 45-year-old men like us and are ready for their first colonoscopy, and that will be something familiar to them. You don't remember the procedure. You don't feel anything during it, but you can still breathe on your own, and it wears off after, it shouldn't take more than an hour or so.
Right. You mentioned in the first segment that Bob Popovich guessing that Vassell will be back around the All-Star break, which is about mid-February. Is that about right? That sounds about right.
I mean, that's a pretty quick turnaround. That would be just what we talked about, the best case scenario. They go in there for the arthroscopy and don't find any structural damage, then he could be back in 4 to 5 weeks. If they find any kind of torn meniscus or anything like that, then I think we're talking about a much more extended timeout. And that, if I were the Spurs fans, I'd be prepared for that, because there's no agenda for rushing him back, given the way the season's going. So if there is anything that even might be structural, I imagine he'd be shut down for a little bit longer than that. I saw one of your listeners put on Twitter the MRI of Devin Vassell's knee and had a picture of Victor Wembanyama inside the knee.
Yeah,
that was pretty clever.
There you go. That's the diagnosis right there. That's what Dr. Ryan would probably put in the paperwork for the Spurs if he was on staff. Here you go. Here's our MRI. Good job, Spurs. All kidding aside. But let's get into it. Okay, so what exactly is the procedure? What is going to go down? ABC 1, 2, 3 X, Y, Z. This us for us, doctor. Make it sound as easy to digest. What can Devin Vassell expect?
Well, he'll go in. Make sure he doesn't eat anything after midnight. They don't want anything in your stomach, because even though you're not doing general anesthesia, when you do get sedated like that, they want to make sure you don't vomit and you can choke on your own vomit, that kind of thing. So first thing first, nothing to eat after midnight on the day of surgery. Then he'll go in. They'll give him either propofol or Versed fentanyl, probably propofol. It's what I prefer when I do procedures in the emergency department, because it's fast on, fast off. So you push it, they go right to sleep. You do the procedure, and then when you stop it, they wake up and they're good to go within about 30 minutes max. Back to your total baseline awake alert with no hangover, that kind of thing. So they'll push the propofol, he'll go to sleep, and then they'll put in the scope, so they'll make a small incision, usually 3 small incisions, that just require 1 or 2 stitches each. And then they put the camera in through the little port, and then you'll have a big television screen that they're looking at. And this is where being a gamer can be helpful for surgeons, because they are looking at the screen while moving around their instruments and the camera. So when you're looking at that television screen, when you move your right hand, forward, it goes backwards on the screen, that kind of thing. So you have to be able to kind of have that dexterity that comes from playing video games, and that moving your hand one way makes it go the opposite way on the screen.
Right.
So it's pretty, it can be a little disconcerting when you first do it, and you have to get used to it. So they'll be looking at the screen, they'll be in there with the camera, in there with their instruments, looking at all the ligaments, tendons, all those kind of things, and using suction or any of the other little instruments to kind of take out any, like we talked about, debris, or washing it out. You can inject saline through there if you need to wash anything out, and then suction to take the saline back out. Then they'll take the scope out, the instruments out, just put those 2 or 3 little sutures. Sometimes they even just use skin glue. Close it back up, put him into a knee immobilizer. He'll be awake probably 30 minutes after that. He'll go home probably an hour or so after the procedure. And they'll keep the knee completely immobilized probably for the first day or so, and then have him start back with range of motion. And then we'll see what they find. If they found any structural damage, if it was just a look and a cleanup. The look and cleanup would have him back in 4 to 6 weeks. Anything that they find structural, we're talking out for quite a while.
Yikes. So perhaps that is the worst case scenario from the procedure. If they see
from where we are now.
Yeah.
With a pre-op diagnosis that does not include from an MRI, an ACL, PCL, or meniscal tear, those are the worst case scenarios. We've already kind of ruled those out with the MRI. So this worst case scenario is they found a little tear that couldn't be seen on the MRI that could put him out for 4 months, that kind of thing. But most likely we're talking 4 to 6 weeks. Everything looks good. So
once he's out, awake, and you mentioned putting the knee immobilized, goes home, pain meds, all that good stuff. How would they manage his pain?
It depends on what his pain was like before, because the arthroscopy, he's going to be sedated for what would be the painful part of it. Coming out, if they don't find anything major, he might require a little bit of pain meds just for a couple of days. You may even want to, stick with non-opiate pain medications. Can be managed with those NSAIDs you were talking about, naproxen, ibuprofen, Tylenol, that kind of thing. If there's intermediate ones, a muscle relaxer like cyclobenzaprine, or even a low-level opiate like a tramadol kind of thing. Probably stopping short of Percocets, Norcos, those kind of things that would be for more intense pain. So I would imagine he could even just do it with non-steroidals after this, because it's not a super extensive surgery.
Right. And I may have misheard you, but did you say it'll be about a 30-minute procedure? Did I hear that correctly?
30 minutes for him to come back out of the propofol.
Oh, come back.
The actual procedure is probably about an hour.
Okay. So an hour. Okay. Well, there you have it, everybody. Exactly what Devin Vassell and the Spurs, and got to look forward to this week. The Spurs did announce that the scheduled surgery will happen in New York City on January 11th. So just this week, Spurs fans are getting bad flashbacks about that. Dr. Kawhi Leonard, New York City. So
that was my only question about this. I'm wondering I don't know who the surgeon is going to be, and if it was one of the Spurs staff or some, why it was going on in New York City and not back in San Antonio with one of the Spurs local orthopedists. But,
the Spurs did announce exactly the name of the doctor in NYC that's going to be handling it. I think it was like Dr. Haas, Hass, I believe. And just like I said, scheduled for January 11th. So
I'll have to look that up. I don't know if that's somebody that's associated with the Spurs, or if that's somebody that Devin Vassell's camp.
Right.
Found independent.
Yeah. Just a quick correction. I'm sorry. It was Dr. Riley J. Williams at, I guess, a location titled HSS in New York on Wednesday, January 11th. So that must be the name of the surgery area where he's gonna be looked at. So yeah, and then the Spurs did say that they will provide updates as appropriate, which means they'll be quiet for quite some time. So. Yeah. That's exactly.
I want to look into that, though, because that's a question I have that I don't have an answer to right now. I would like to know why the surgery is happening in New York City, and is this one of a doctor that's associated with the Spurs, or one that was picked by Devin Vassell's
right? Exactly.
Camp.
Yeah. I'm not trying to open old wounds here, but Kawhi Leonard did opt for a New York-based doctor for a second opinion. So perhaps that's just kind of the players and the agents' word of mouth, like, you want to get the doctors from New York. I mean, it could be something like that, but I don't know. But yeah, it is. That's what the Spurs said, so that's what we're telling you guys here. But all in all, hopefully Devin Vassell will be okay, Doctor. It looks like he might be all right.
Oh, yeah, he's going to be fine. we would have known already if it was one of those major injuries we talked about. So he'll do well. I do want to know about that New York thing. I'm having those flashbacks with Kawhi as well.
Yeah, maybe this will hit the eject button. All right, so when we get back, we're going to wrap up our chat with Dr. Ryan McCorkle right here on Locked On Spurs. Once again, make sure to follow him on Twitter at AustinER.Doc. But before we do that, I want to talk to you about Built Bar. Look, are you looking for a delicious treat, but you don't want all the fat and calories? Then you got to try a Built Bar. Look, we just got through the holidays. I know your goal perhaps is to eat a little healthier this year. Or if you're like me, you just want to eat healthier, period, but you don't want to compromise taste, then we got something for you. You got to try Built. With Built, healthy is actually tasty. Seriously, you're gonna love these. They're so delicious, you won't even think they're even good for you. They're perfect for your New Year's resolution. What makes Built Bars so good? Well, for starters, they're covered in 100% real chocolate. That's right, real chocolate. They come in unbelievably great flavors such as churro, peanut butter brownie, coconut almond, and much, much more. Look, I don't know how Built does it, but they do. These Built Bars taste like a candy bar while maintaining amazing macros. What's even better that they are healthy. 130 calories, that's it. 4 grams of sugar, that's it. And a whopping 17 grams of protein. And you don't have to wait around to get a box anymore. For years, Built has been talking about ordering Built Bars that you can at Built.com. Well, now you can get them at your local Walmart or Sam's Clubs. That's right. Head to your nearest Walmart today, walk to the pharmacy section, grab yourself a box of Built Bars. You can pick up a 4-bar box of cookies and cream, double chocolate, or coconut puffs. Or if you're close to a Sam's Club, run in, grab yourself a 13-bar box with hit flavors such as brownie, batter, churro, and you can thank me later. We're back right here on Locked On Spurs with Dr. Ryan McCorkle. He is making his weekly visit right here on Locked On Spurs, and he just wrapped up talking about Devin Vassell and the surgery he has ahead and what his injury is about. If you want to chat with Doctor about that, again, follow him on Twitter at AustinER.Doc. But, Doc, before I let you go, this has been talked about around the sports world, not just the NFL world, and that is that terrible scene that we happened with Buffalo Bills' Damar Hamlin. During the game, he collapsed. The game was postponed and now canceled. You've been making the rounds. You've been talking about this. For those Locked On Spurs fans that are concerned about Hamlin, what is going on with him?
Well, again, it's speculation until we get a real diagnosis. But from everything that we've been able to ascertain by watching it and what happened after, it looks like something called commotio cordeo. And that is where you get impact to the chest wall in just the right moment during the electrical activity of the heart. And it throws you into an abnormal rhythm called ventricular fibrillation or ventricular tachycardia, where the heart is just quivering and it can't pump blood forward effectively. And so that's why you have a couple of steps while you're still getting blood flow to your brain, and then you're not getting blood flow to your brain anymore, and that's when you see him collapse. It happens a lot with direct impact to the chest. Not a lot, but it happens from direct impact to the chest, often by getting hit by like a baseball, a hockey puck, a lacrosse ball. Those have been cases that have been reported of how it happens. But there's literally 1/100 of a second, a millisecond, during the upstroke of the T wave. It's a very technical term for a portion of the electrical circuit of the heart. It has to be hit immediately in that millisecond for it to be thrown into that ventricular fibrillation rhythm, which is what happened to him. And that's why he had to be shot. And this is why we keep automated external defibrillators or AEDs in all public places.
Right. Yeah. So, it was just a scene that just shocked everyone. I mean, sports fans, non-sports fans, to see an athlete. You think of athletes, doctor, you think that they're invincible, they're impervious, they're in perfect health, but they're just as they get succumb to these type of injuries. We saw with Devin Vassell. Look at Devin Vassell, same thing. 20-year-old kid, having to deal with surgery already. You have Hamlin, you mentioned, got hit likely at the right time, at the right spot, and went down. So I think that puts in perspective that these guys are just human, just like you and me.
That's exactly right. It gives a whole lot of perspective about this being bigger than just a game. and that these are human beings with families and lives outside of just entertaining fans.
Mm-hmm.
And maybe sometimes we forget that. And this was a good reminder of that.
Right. And I know you don't want to speculate too much. You're not in that room with the Hamlin, but when you're experiencing dealing with these types of situations, how long does a person come out of that, and what does it take to just get back to 100%?
Yeah, well, Commotio Cordeo, that is just a 1 in a billion bad luck to get hit in the chest,
mm-hmm.
in the right spot, during the right part of your heart's electrical activity. I mean, that's a 1 in a billion. So if everything came back, then okay, he could possibly come back and play. There's been speculation that he had to be shocked a second time on arrival to the hospital, which might indicate something else beyond just Commotio Cordeo, that may, if he required like a defibrillator or something like that, then that could be an end of a career. But we don't know those details yet. So we're hoping that it's just the Commotio Cordeo, and he's already got return of neurologic function. He's off the ventilator, breathing on his own, talking, no signs of any permanent, what we call anoxic brain injury, where you didn't get
mm-hmm.
blood flow to the brain damage. Don't see any of that at all. So far, this is the best news we could possibly have. And it was wonderful to see.
Mm-hmm.
I guess a little background. First, talking about Vassell, that I went to medical school in San Antonio at UT
mm-hmm.
Health Science Center, and it has one of the best orthopedic programs in the country. So, that's why I was wondering why his knee surgery would be in New York, because we have such great orthopedic programs and doctors there in San Antonio. On the flip side, I did my residency training in Buffalo, New York, at Erie County Medical Center and Buffalo General Hospital and Women and Children's Hospital in Buffalo. And we worked with the Bills. We were on the sidelines for the games. It was an incredible experience. And those Buffalo doctors and their staff are also just incredible. And I think you saw that with the first responders on the sideline. They saved his life getting an automated external defibrillator and immediate bystander CPR. And I think if our listeners take anything away from this, that is number one, learn to do CPR. You can save a life. And even more than that, the automated external defibrillator, ventricular fibrillation, ventricular tachycardia are things where people have their sudden cardiac death. They just drop and they die. But those AEDs can make a difference in somebody not just surviving, but going back to the way they were before. And in medicine, that's just something that's a unicorn for us. That's what you're looking for. It's not just to help people feel better or manage something. It's to be able to take them back to the life they were leading before and feeling good and feeling productive. And with an AED, you can shock somebody out of something that could have killed them and get them back to their normal life. And that's one of the most rewarding things you can do. So learn to use your AED, learn to do CPR. You've seen it with Damar Hamlin that you can save a life.
Absolutely. Look at that, doctor, giving everybody the heads up and why it's important to learn, as you mentioned, CPR and using those AEDs. I've seen those. Those are basically those. They're like stuck on the wall. Those boxes, kind of like a fire extinguisher. They're like right near there.
Exactly right.
Yeah.
They're usually near a fire extinguisher. You put them on, and they are. I hate to use the term, but it's what we say in the hospital. They're idiot proof. They actually, it tells you, it's got pictures on it, and once you put the stickers on the two places where it tells you to put them on, the machine talks you through it. It's not even you have to read something. It will talk you through it. It will say, shockable rhythm, press, the button, and it does it all on its own. Nice. So this is not complicated. People don't need to feel trepidation about, literally just take it down, tells you where to put the pads, and tells you what to do.
Awesome. Good news right there, and a good PSA from Dr. Ryan McCorkle. Hey, we're done talking. We want to hear from you. What are your thoughts about what the doctor had to say with Vassell heading into surgery this week? Feel a little better about it? Are you worried still? And what are your thoughts on the Hamlin situation? Hopefully he is doing well. Once again, Doctor, we thank you for hopping on Locked On Spurs, but tell us what's going on your side of the neck of the woods over there with Backstage.
Oh, yeah. We are doing a ton of stuff. Of people that are listeners that follow me on Twitter and Instagram, they can see I've been doing one of the functions I perform for my hospital is doing the media appearances. So I've been on all the networks talking about not just the Damar Hamlin thing, but also, COVID flu triple-demic kind of stuff. So you can see all those clips on Instagram and Twitter, and still doing the backstage medical thing with several concerts coming up, and then just finished getting the schedule done for Austin FC, and about to waiting for the schedule to come out for UT football so we can get all the docs ready for that. And there's a good segment on there too about what we do in the stadium to keep all the people there safe in light of the Damar Hamlin incident. So people can check that out as well.
Look at the doctor. Look at that, making his rounds in the emergency room and out of the emergency room. You're a one-man band.
Oh, I appreciate you, Jeff. I appreciate you.
Anytime. But hey, we'd like to thank you for making Locked On Spurs your first listen each and every day. Second listen, check out Game to Game NBA. Every moment, every top performance, every result, Locked On Game to Game covers every game from across the NBA with local analysis that only Locked On can deliver. Follow Game to Game on Locked On NBA, available on the Odyssey app, YouTube, wherever you get podcasts, as well as Locked On Spurs, available on the Odyssey app, YouTube, the Kens 5 Plus app, and many other platforms. So for Dr. Ryan McCorkle, I am Jeff Garcia. We're going to put a lock on this episode of Locked On Spurs.